Hello and welcome to today's MTF Biologics live streamed event. Thank you so much for joining us. I'm Pam Rollins and I will be your host today. This week across the United States, we are celebrating Pediatric Transplant Awareness Week. Pediatric Transplant Awareness Week provides a platform to talk about the powerful message of ending the pediatric waiting list for children waiting for organ transplants and to honor donor families who have suffered the loss of their own children and through their generous gifts have saved and healed others' lives through organ, tissue, and eye donation. MTF Biologics has a long history of saving and healing the lives of children. We were founded by a group of orthopedic oncologists who were looking for high quality grafts for their patients, and it is still one of our cornerstones. This week gives us a unique opportunity to shine a spotlight on how tissue donation helps children heal with the use of that donated tissue. Tonight, our session is Healing Children Through Tissue Donation, and we have three special speakers from MTF Biologics, and after their presentations, we will be addressing any questions you may have. But before I introduce our speakers, I'd like to begin with a story about 6-year-old Katie Coolican and the remarkable impact she left on this earth after her untimely death. Katie Coolican was a bright-eyed, freckled, red-headed tomboy. She was the youngest of Maggie and Don Coolican's 6 children. Katie couldn't wait to see what life had next for her, wanted to grow up to be a mud wrestler, collected rocks, loved swimming and adventure. Sadly, after waving goodbye to her mother, as she got on the school bus one morning, Katie died of an AV malformation in her brain. She became an organ donor, saving the lives of others. Katie was such a delightful, playful child that a playground was dedicated in her name. But Katie's legacy didn't end there. At the time of Katie's death, there was really no support for donor families, no support groups, letters, medallions, donor family ceremonies, or parades. Her mother, Maggie, through her own grief, changed that, and her work really changed how donor families are treated today. Maggie wrote a pamphlet called For Those Who Give and Grieve, which was given to over 125,000 donor families. She started a newsletter of the same name, which was funded by MTF and distributed by the National Kidney Foundation. Maggie was instrumental in starting the National Donor Family Council and was their founding chair. She helped write the Donor Family Bill of Rights, and her most well-known contribution is the donor quilt. You can see a picture of Katie's quilt square. Maggie herself and a group of volunteers have sewn every square of the hundreds of donor quilts that grace the U.S. memory in their loved ones. So now let's go ahead and start with a few facts about donation. People of all ages and medical backgrounds can be donors. So if you think that you may have some condition or are too old to be a donor, please go ahead and register if that is something that you would like to do. Our criteria changes constantly, and there is often always an opportunity for just about everyone. Over 2.5 million tissue transplants are done every year. So that's 2.5 million individuals every year who receive a donated gift. This is in huge contrast to the number of organ transplants that are performed every year, which is really just about 45,000, and of course still has a giant waiting list. But most of the transplants that are done in the US are actually tissue transplants. And one tissue donor can help anywhere from 50 to over 75 individuals. So it really is a huge gift, and just makes a tremendous difference in the lives of others, as we're going to see today as we go through our speakers and our slides. Thanks so much. So what kind of tissues can be donated? Well, corneas and sclera can be donated from the eye, and these both have really life-saving or eye-saving properties, and certainly corneas absolutely can restore vision in others. Cardiovascular tissues include heart valves, veins, arteries, and the pericardium. And heart valves are most commonly used in children, and there really is a high demand for heart valves, particularly small ones that can be used in children. For musculoskeletal transplants, and this is what we're primarily going to be discussing today, we have bone, tendon, ligaments, and cartilage. Skin can be donated. It can be used for burn, wounds, and other surgical applications. And birth tissues can also be donated. So after a woman has given birth, she can donate the tissue from her placenta, and the amnion and the chorion, and even the umbilical cord are all used from birth tissue. So there really is a wide variety of what patients can donate and contribute, starting right at the very beginning of their life. So now we're going to kind of talk about a few bone grafts. I'm going to bring on Kevin Fallon. He is our expert today on orthopedic grafts. So Kevin, why don't you go ahead and take it away and tell us a little bit about what we're seeing here on the screen.
Sure. Thank you, Pam. Appreciate it. And thank you to all the viewers who are joining us today during National Pediatric Transplant Week. I'm really grateful for the opportunity to speak about MTF's mission and introduce some very special recipients of our allografts. So before we do that, let's talk about what we see on the screen there. MTF has a wide range of allografts designed to meet the needs of patients with musculoskeletal disorders or injuries or degenerative conditions. Our solutions are unique because we are making these allografts from generously donated human bone and tissues, and those have been carefully selected to ensure safety and effectiveness. So by using donated tissue, we can provide our patients with a natural biocompatible option for all types of orthopedic conditions. The allografts that you see on the screen can be used to rebuild limbs affected by cancer, restore mobility, reconstruct damaged bone tissue. Our allografts are also used in spine surgeries and dental procedures. And interestingly, some of the grafts that you see on the left there are made by computer-controlled machines or CNC machines in our lab operated by some of our processing specialists. So we have a very unique and very intricate, very complicated array of grafts to offer.
So Kevin, one thing I just would like to clarify for our audience, I know it's a word that, we use all the time at MTF, and that's the word allograft. So the word allograft means a tissue from someone else. So autograft would be tissue that came from yourself, and allograft is something that comes from others, so a donated gift. And then the third term that we'll occasionally use, although not in today's presentation, is xenograft, and that means where a gift comes from another species, such as a cow or something like that, like some of the bovine heart valves. So, so anyway, I just wanted to clear that up. But can you tell us a little bit about those three little grafts in the middle there that have those fine teeth on them? What are those used for?
Yeah, sure. So those are special grafts used for spinal fusion and different kinds of spine surgery in the lumbar region. Their unique shape allows a different approach, whether that's anterior or a lateral approach to these procedures. And if you look very, very close, you'll see that there are tiny little pyramidal teeth on there. And those are there on purpose and allow and actually disallow the migration of that graft once it's in situ. So once the surgeon places that graft, it shouldn't move based on that configuration and those teeth. And sometimes you'll see an opening in the middle of that graft, and that allows us to place either the patient's bone marrow or some other type of morselized graft within the allograft itself. So that improves healing in a lot of cases.
It's pretty amazing. So I know next we're going to talk a little bit about rebuilding limbs affected by cancer. And that would be the large graft shown there at the bottom. And I know we have a little recipient story to kind of start us off there.
Michelle had called me one day and she said that she had noticed a bump in Chase's arm. And he was very active in gymnastics, and so we really didn't think too much about it. But after a week or so, it really hadn't changed. We took Chase in and took the x-rays with us, and he left the room and was probably gone about 15, 20 minutes, something like that. And when he come back in the room, you could tell by his face that he did not have good news.
Chase turned 9, and the following day was diagnosed with osteosarcoma.
I had my suspicions at that time, and those were confirmed by a biopsy a few days later that he had osteosarcoma in his radius. Osteosarcoma is a bone cancer. This was a fairly large tumor in a pretty small arm. We initially had some discussions about doing an amputation, and after several long conversations, we decided that we would make an attempt to do what we call a limb salvage procedure, which is to take the tumor out and leave the hand and arm behind. The problem was reconstructing to give Chase an arm that he could have good function with. We had a large defect in one of the two bones in his forearm, was missing about 2/3 of the length of that bone.
When I went into the surgery room, I was kind of scared because I thought I was going to lose my arm.
Walking into the operating room to operate on a 9-year-old boy, I have to check my emotions and everything at the door. I have to be a technician when I come in there, and we go into the operating room, and I'm looking at this arm, and I have a picture in my head of what my plan is.
The surgical nurse said, "I'll call you every hour in the waiting room." And I believe it was the 6th hour the phone rang. And I'll never forget, she said, "I have really, really, really good news." And I knew after 3 reallys she wasn't going to tell me the amputated. She said, "We've started the limb salvage."
After removing the tumor, we did feel as if we'd done a safe surgery by using donated bone. From the bone bank, we were able to reconstruct and give him an arm that provides him with considerably better function than he ever could have had with a prosthetic limb after an amputation.
We knew through the years that organs and eyes and things like that were donated, but we had no idea that people actually donated tissue and bones. Dr. McGarry gave us the option of taking the cancer-fied bone out and transplanting a bone that someone had donated.
We had hoped for similar function, basically pinchers like a prosthetic would have. And we came out with an arm that has 5 fingers that move. He writes his name. He throws a ball. He plays video games. He rides a 4-wheeler.
We had no idea that that was even possible. We always knew about the organ donors and all that kind of stuff, but we really didn't have any idea about becoming a bone donor.
When I woke up, as soon as I did, I looked down, and my mom was coming up in the elevator. I looked at my arm and then looked at Mom. I said, "Mom, look," and all 5 fingers moved.
I can't tell you the hope that gives you and the feeling that gives you.
Chase has almost full function back now. It's interesting how a PlayStation 3 becomes physical therapy. It's done wonders for his fingers and thumb.
Now I can play basketball, baseball, ride my bike, my scooter, go swimming. Me and Dad were going outside, and I asked him if we could play catch. And when I threw it, it went right over Dad's head.
At this point, I can't imagine there's going to be much that's going to ever hold him back in life. And that's why we are so appreciative of the choices that people make. It doesn't affect just the person receiving, it affects the whole family.
One person donating their bones or their body after they're gone can help up to 50 people. We were faced with a loss. Now we are faced with a miracle that we look at every day, and thank God somebody had the forethought to donate their body, their bones, their tissue to someone else who can use them. Thank you.
It's a great legacy for them to leave behind for their loved one. I'd like to say thank you to people that say yes to becoming a donor, a tissue donor, a bone donor. And thank you to MTF for making my child's future look very bright.
That is such a powerful story, Kevin. You know, every time I see it, I just can't imagine being a parent and hearing that your child not only has, you know, a deadly cancer, but that they may be facing something like amputation. So can you tell our audience a little bit about how that process works, how tissue is found for these patients, and how we figure out which piece of tissue would be best for them?
Sure. First of all, I mean, you're right. I mean, Chase's story, I mean, it just shows you the impact that organ and tissue donation has on the lives of those in need. So this is, you know, a powerful and moving video for real. And it's the reason why we love, especially in graft matching, doing this kind of work every day for these patients. So it all kind of begins with a request from the surgeon. And some of them come in the form of special graft requests. A lot of our patients are pediatric. So it's really difficult to find donor bone that's the size of some of these children that we need. So it really just starts with our graft matching services team beginning this process, being contacted directly from the surgeon. And those incoming requests are usually tissue type that we don't normally procure or produce at MTF. And sometimes, like I said, we have very young patient in need of a limb sparing surgery. And that bone needs to be within very, very specific tolerances of the patient. And that patient donor match has to be very, very close. So when that happens, we work close with the surgeon, the organ and tissue procurement teams, and donor services to find that perfect match. What happens is our team of graft matching specialists are capable of reviewing the patient MR, the magnetic resonance imaging, the CAT scans and X-ray measurements, and then we make a recommendation based on them. Our processing specialists in our core, they're able to take what we've done and actually work with the procurement team and incoming donor teams to produce this exact graft that we need. But what's really special about the pediatric request at MTF is the teamwork. So when these requests come in, everyone from the recovery partners to planning, processing, operations, quality, IC, shipping, receiving, everyone gets involved and comes together to make this happen, especially when they're pediatric patients. We put 100% into all our patients, but there's certain special patients that everyone just loves to work with. And it's quite special to be part of it. So it takes the entire organization to do what you just saw with Chase's allograft.
Yeah, it really is quite remarkable. So I know, Kevin, we're going to be bringing you back on in a little bit to discuss sports medicine. Your work at MTF is quite a broad range. And now I'd like to bring on Lisa Miller. Lisa Miller is our expert in our plastic and reconstructive surgery division. So Lisa, tell us a little bit about what you do. Tell us a little bit about the grafts that come from your division. I know one of the ones we're going to talk about today are these cartilage grafts.
Yeah, thank you, Pam. So one of the donated cartilage tissues that can be used by plastic and reconstructive surgeons is costal cartilage. Costal cartilage is found on our ribs, and it allows your rib cage to expand and contract when you breathe, sneeze, cough. Donated costal cartilage is used in cleft rhinoplasty to reshape the nose of children who are born with cleft lip and palate anomalies. In addition to the cleft, they often also have an asymmetrical nose that appears kind of flat and broad, as you can see in the photo here on the left. This is a patient of Dr. Christopher Derderian. But with the use of donated cartilage, costal cartilage, this young lady's nose was reshaped so she has a more natural projection of her nose.
That's amazing. And I know sometimes in rhinoplasty surgery, they'll take tissue from the patient themselves somewhere like behind the ear or something like that. Why is it that that's not, the more common thing or isn't always used in these types of surgeries?
Well, when they do an initial rhinoplasty, they will try to use the patient's own septal cartilage. But if they have to go to another part using autologous cartilage from somewhere else in the patient's body, that does present, additional risks, comorbidities. There could be, now you have another surgery site that needs to heal. So it's a lot more convenient and better for the patient and the surgery if you can use donated cartilage instead.
Absolutely. That makes total sense. So tell us a little bit about these microtia grafts. These are just amazing.
So another use of donated costal cartilage is to treat microtia. And that's a condition in which a child is born with an abnormally small or missing ear. It's usually unilateral, meaning it occurs on just one side. It's more prevalent in boys and those who have Hispanic ethnicity. It can present as a single anomaly or as part of a syndrome, such as Treacher-Collins, in which a child has other additional physical anomalies and mental delays. But so you can see on the left, this is the ear that the child was born with. It just kind of looks like an ear lobe. But then we can use donated costal cartilage to actually construct an external ear. And that's what you see in the center there. And that's going to then be inserted under a tissue flap on the affected side. Now, in this procedure, traditionally, like you were saying, costal cartilage from the child's own rib cage is often used, but that can carry with it a host of complications such as a collapsed lung, a chest wall deformity, and it does require a very lengthy operative time, hospital stay, and an even lengthier recovery. So using autologous costal cartilage or cartilage from the child's own rib cage also requires the child to be old enough to have large enough cartilage to support the reconstruction. So that means often you have to wait until the child is like 8, 9, 10 years old. Whereas if you use donated costal cartilage, that reconstruction can occur at around age 5.
That is really remarkable. And certainly it's around age 5 when a child is going to school that, some of the more cruel aspects of childhood can crop in with kids being teased or bullied or something. Kids seem to attach themselves to anything that's different. And so it's just amazing that they can do that. And it looks like the rib piece, the graft up there, really the rib cage is sort of naturally formed to create these grafts.
Yeah, it works really well. And just like they would use cartilage from the child themselves, we provide that same cartilage from a donor. So yeah, it works really well, and you can avoid all of those complications that I just mentioned and a much speedier recovery for the child.
Yeah, that's remarkable. So, and I think you have another little patient who has received a microtia graft.
Yeah, so this is Luca. Luca's a 5-year-old little boy from Long Island who was born with microtia. And you can see the ear that he was born with is kind of that lobe-looking appendage there. But luckily, his pediatric plastic surgeon, Dr. Nicholas Bastidas, who is also in the photo there on the right, he's one of the surgeons who was instrumental to working with us to now allow us to bring our costal cartilage graft to the surgical community, and that's called Externa. So Luca underwent ear reconstruction using Externa. This photo is from a press conference in which he got to meet Iron Man. He was presented with an Iron Man figure, and really they were just talking about his bravery in undergoing this procedure using donated costal cartilage, because like I said, traditionally only autologous or cartilage from the child themselves is used for this type of reconstruction. But his mother was saying during the press conference how immediately following the procedure, he was much happier. He had much more confidence. It really made a big difference in his disposition to not have to see himself as different when he's among his peers at school and other activities.
Yeah, that's remarkable. So what other kind of grafts are used in the plastic reconstructive division?
Well, we also have skin grafts. So those can be used for plastic and reconstructive surgeries, in hernia repair, to treat burns and wounds, and also for cleft palate and periodontal procedures.
So, so these dermis grafts, they just essentially come from donated skin from, possibly the back of a patient or the thigh of a patient or something like that. And it looks like they can be specially shaped for all different kinds of procedures. I think you have the story of another young patient who's received a skin graft.
I do. So this is Blake. So Blake was born with a cleft lip and palate deformity. His parents were informed that he had these anomalies before he was born, so they were prepared to address them, when he was born. Now, we often associate cleft lip and palate with third world countries, but they're just as prevalent in the U.S., occurring in about 1 in every 1,600 births. So a cleft just means that there's an opening where there shouldn't be. If it's a cleft lip, it just means there's an opening in their lip. And if it's a cleft palate, they have an opening in the roof of their mouth or their soft palate there. So knowing that they had this child who was being born with the cleft lip and palate, soon after he was born, his parents promptly met with the cleft team, and he was able to have the lip repaired at 4 months, which you want to do that early on because it can present problems with feeding. And then shortly after, he had his palate repaired using donated skin or a donated dermal grafts. And as you can see, he's doing quite well. His mother, Rachel, said that she felt it was karma that he received a donated skin graft because years ago, her father, when he passed, he was a donor. So really the cycle and the beauty of donation was really appreciated with this family.
Yeah, it was such a darling family. And Blake is the youngest of 3 boys, so it's a very, very active family. And I think Blake is the middle one. And that is such a remarkable repair. I mean, he just looks amazing. Will he keep, like, those grafts will just continue to grow with him as he gets older?
Yeah, it'll actually become part of his own skin through a process called integration. So when they repair the palate, they will actually cut the soft tissue that is there and stretch it to cover the defect. And then if it's quite a wide defect like Blake had, they will use the skin to kind of reinforce it. But yes, it will stay with him and become part of his own body.
It's just remarkable, just amazing. So I think you probably have some other stories for us to hear.
Yeah, so this little guy received a skin graft for a burn wound. He was treated by Dr. David Culber, who goes to Mozambique as part of the Mending Kids program. And donated skin can be used for burns. It's a temporary treatment. It really provides a barrier to keep out contaminants until it's healed enough until it can be covered by a permanent skin graft taken from somewhere else on the patient's own body. So this is a little guy. He was treated as part of Mending Kids for a burn. And as you can see there in the picture, he's got a teddy bear with him. And that was received as part of our Healing Heroes program. So in addition to providing donated skin, we also provide teddy bears to kids as part of the Healing Heroes program. So any child who receives one of our tissue grafts is eligible to receive at no charge this Healing Heroes kit. That includes a teddy bear that's dressed like a hero, a child-size hero mask and cape, an activity book and crayons. Also in there is a letter explaining about the Healing Heroes program and that it's meant to honor our donor recipients and our donor families, and also a letter about our Linking Lives program.
And this bear program, I know MTF has had almost since its inception, where we would send one of these teddy bears out to some of these pediatric patients who are really enduring, a pretty major surgery, pretty major medical intervention for them that can be a little painful. So I love it. And I think the kids love it too. And their parents really appreciate somebody taking that little extra step for their child. So you mentioned the Linking Lives program that we have at MTF. And I know this is a program that we have that tries to link donor families with recipients, or recipients with their donor family. It's kind of a thank you letter program. And we send out about 30,000 letters. We've received 30,000 letters back from donor families. And really that's only about 1% of our families who will receive a letter back from a family. So it is a really important part of what we do. And it's how we get these great stories.
Absolutely.
So I think, are we going to go to wound care now with Alyssa? Hi, Alyssa. So Alyssa is our wound care specialist at MTF. And one of the newer grafts that we have for wound care are our birth tissue grafts.
Yeah, thank you, Pam. Good afternoon. We have a wide variety of options and offerings within the wound care franchise. And as Pam had mentioned, women who are pregnant may have the option to donate their birth tissue, but this really depends on the hospital that's facilitating the delivery. Of the various options within our portfolio, on the left-hand side, we have 2 different formats. We offer placental tissue or birth tissue in. We offer our tissue in a sheet format, which is that top circle, and the bottom just smaller, shakeable. You can shake them out of a small vial. And really these options are used as a wound covering or a barrier and can treat a very wide variety of different wounds like diabetic foot ulcers, venous ulcers, pressure ulcers, any kind of traumatic wound. If someone suffers an injury from a natural disaster or a car accident, for example, we have this tissue and more to help heal.
It's really remarkable that that the placenta is used in that way. And it's my understanding that the patients who receive it really have great results, and it shortens their recovery time significantly.
Indeed, yes.
That's fantastic. So what else, what other kind of tissues are used for wound patients?
We do also have skin or dermal allograft options, and they come in a sheet format, which you see on the bottom there. Then we also have meshed versions as well. And it really depends on the type of wound that's being presented. And we have all these options because there's no linear path to wound closure. And so we have these options to address the patient every week or every time they're seen by their doctor. What kind of tissue do they need to help get to that closure point? And so this tissue also can be used in the treatment of chronic wounds. So those are your diabetic foot ulcers. If you have venous insufficiency and an ulcer forms on your leg, we have tissue for that, as well as various traumatic wounds and complex wounds.
So that's great. And I think you have some stories to share with us.
Yes. So thank you so much. Today we're featuring 16-year-old Alyssa, who leads such a vibrant life, as I'm sure we can gather from the images that are on the screen. They have a wide variety of Alyssa at basketball games, helping on her family's farm. And also Alyssa is the oldest of 4. So she has 3 younger siblings that she helps her family make sure that they're taken care of, that they have eaten dinner, they've taken their baths, brushed their teeth. And Alyssa's active lifestyle really depended on her ability to walk and really depended on her feet, right? And so when Alyssa was helping her father with some welding equipment on the farm, and as we all know, welding equipment can be very, very heavy, 2x4 slipped and the equipment fell off that piece of wood, and it did hit her ankle. Thankfully, X-rays revealed that Alyssa did not suffer from any kind of break or fracture or even the need for an amputation, which is miraculous. She came out of that altercation with just a scrape. When the adrenaline and the shock wears off, and it's been some time, her family had noticed that scrape turned into a non-healing or chronic wound. And so Alyssa went from what we see on the screen right now, being on her feet, enjoying time with her friends, helping her family, to having very limited mobility, if honestly not being able to walk at all because of how this wound had developed on her foot. So we had utilized Allopatch Pliable to address Alyssa's wound, and it was a little bit deep. And so we love that we have different options, whether it's placental tissue or dermal tissue or skin, and varying thicknesses, because wounds are all different. They're all not the same. So we were able to have Allopatch Pliable available, the sheet version of our dermal offerings, to help Alyssa heal that wound. And within 2 months, we have remarkable results where she actually has full mobility once more. Alyssa is an aspiring veterinarian, and just being back on both feet, I mean, with whether you're looking at a horse or a guinea pig, you have to be on your feet and you have to make sure that you can assess your patient, right? Furry patient, no matter what. And so being able to be back on her feet, help her family. Alyssa loves rodeos. She is now finishing up her junior year of high school. We are in the spring season, so that's softball for most high schools. And Alyssa is able to hit a home run and run around the bases, and then at the end of the day, get back on there with some rodeo and get back to a life that she once lived and have an even better quality of life moving forward.
It's just incredible. And, I realize she's 16 and a junior in high school, but she's a very tidy person to be bossing that very large animal around in that ring. And that's another, had that gone another way with something like an amputation, it just could have been awful. So I know this is a letter from her mother. I'll let you go ahead and read that.
Thank you. I think what should be mentioned also is the resilience of spirit and having a great life, wanting to get back to that life, knowing what you can do. It shifts the perspective. And I think there's a new sense of gratitude and also education around what we can do with the gift of donation. And Alyssa's mother, with this quote here saying, "We are blessed to have been able to save her foot. It's something that we'll never forget and is now a part of our lives. If anyone would ever need tissue, I would want to help them, just like someone gave to help my daughter." And being able to present this story and raise awareness and continue to educate is always so important, because there are people like Alyssa who have families that just want the best for them and want them to be back on their feet and smiling again. And so not only does that wound impact the individual, but it impacts so many more people. So it's very, very valuable to be a part of this.
Sure, absolutely. And that's very true. Again, just like with Chase's family, to have that news that your child, has this terrible wound or condition or something and may suffer a long-term consequence such as amputation is just so terrifying. So to be able to prevent that, you're right, it impacts the whole family, the neighborhood, and obviously her future for what kinds of opportunities she may choose to have as her future. So I think at this point in time, Alyssa, we're going to go back to Kevin, and I'll be bringing you back on for questions. I'm sorry, before we jump to Kevin, let's talk a little bit about adipose. I apologize. I forgot that we had one more tissue to cover. So why don't you tell us how adipose, or fat that everybody wishes they could donate, is used to treat these wounds?
I'm definitely on that list, wanting to participate. We do offer, among our options, adipose or fat tissue, as Pam had defined, in the treatment of different chronic wounds or diabetic foot ulcers, preventing them from recurring. We, of course, manage wounds that are caused by people with diabetes, because they at some point can lose feeling in their legs and their feet, and they may not realize on the bottom of their feet a blister had formed, and that constant pressure and constant walking, they're not feeling that pain, which can lead to a chronic wound. There's really no chance for them to say, my foot hurts, let me put my feet up and give my foot a break, honestly. Yes. And so having Leneva as an option to really look beneath the surface, there are so many talented and skilled physicians we work with that can see from a mile away whether a chronic wound is going to form. And we're able to restore the fat that is really diminished, hence leading to that blister and then the wound, because everything is being worn down by that constant walking and that constant pressure. And so we're able to not only address the wound from beneath the surface, but hopefully prevent or stave off the recurrence for as long as possible with Leneva.
And, this seems like, it might be somewhat of a small thing, those syringes and the adipose tissue, but, this can lead to patients being wheelchair bound just because they can't bear the pain, in their feet, or it just continues to get worse. So,
Absolutely.
It may seem like a small thing, but again, has just an enormous impact. And just for our audience, this adipose comes from deceased donors, just like all tissue donation. It comes in with dermis grafts. And so we do not have the option, much as we would like to donate our own adipose into this program. I'd like to clarify that. So tell us a little bit about this case.
Yeah, thank you. So this case presents as a young man who was suffering from soft tissue defects in his heels. As you can see on both of his heels, there's some discoloration on the bottom there, which really prevented him from walking, from running, from playing sports, from helping out his family. So very similar lifestyle to Alyssa. And for teenagers and young ones, having that activity, that high level of engagement and movement is such a key component of their lives. I mean, how many of us remember playing out in the neighborhood when we were young? Recess, that's a big deal. So there's a lot that we use our feet for, particularly as young ones. And so not being able to have that mobility is very debilitating physically, but also socially, mentally. I mean, the list goes on. And so this young person came to us, and we were able to provide Leneva to relieve the pressure in his heels, which led him to be able to walk again, significantly less pain. The fat pad that was diminished has been built back up. And again, it's all about relieving that pressure. I mean, our feet do so much for us. We should thank them every day. They hold us up. And so being able to provide this mobility back to this individual, back to this young person, along with his compliance with physical therapy and making sure that when he's supposed to stay off his feet, maybe immediately after injection, for example, that he does that and follows the rules. And we were able to really support him getting back onto his feet, walking again, playing soccer, helping out his family, running around, and really supporting him in the journey he wanted to go on.
It really is powerful. And again, to think about someone at that age ending up being wheelchair bound, or just, having to adjust their life so differently if they, were able to continue walking, maybe in some type of a special shoe. So a very powerful gift, small piece of tissue, but a very powerful gift. So now I think we're going to move back to Kevin and talk a little bit about the sports tissue grafts.
Awesome. Thanks, Pam. Yep. So our soft tissue allografts are used to repair things like damaged tendons and cartilage in patients, whether they're highly trained athletes or moderately active persons. They're commonly used to provide a natural and durable solution for repairing injuries caused by repetitive motion, trauma, or other mechanism of disease, as you'll see with our story coming up with Naomi. They're typically used for conditions relating to damaged structures such as ACL, which is our anterior cruciate ligament, meniscus, rotator cuff, and then we have cartilage allografts that are used to treat injuries in the cartilage of the shoulder, knee, elbow, just about any joint that you have articulating cartilage, we probably have a graft for. So by utilizing these types of allografts, sports medicine professionals are able to provide our patients with safe and effective options for restoring joint function and facilitate healing. And this all helps the patient return to their natural pre-injury condition or very close to it.
And even, as you said before, patients who are not necessarily, athletes, to be able to reduce that pain and allow them to, get back to something they love, which is certainly part of the story, Naomi's story, that we're going to go to next, about a young girl who wasn't was never going to be a professional athlete, but what a powerful gift this has been to her and her family.
I was standing in the outfield. She got a hit, and I watched her going around the bases, and everybody's cheering, "Yay, Naomi, yay, go, get a home run." And she went past home plate, and as she was going toward the dugout, she went down.
After she had fallen, her knees were so unstable that it was necessary to have a wheelchair for her to be in anytime she had to go anywhere.
It was like maybe once a year, her kneecap would pop out and she would fall and it would hurt. But then when she got to be about 9, it started popping out like 2 or 3 times a week. I said, we need a little more aggressive approach to this.
After she fell and was hurt, we decided that we needed to look at the surgery and talk to Dr. Locke, and he explained what he would be doing.
A lot of the kids with Downs will develop this problem where their kneecaps keep popping out. And the reason is the Downs tissue is diseased, and it is the ligament that is just like gum or like taffy. So if I use her ligament to reconstruct her kneecap, then it just fails over time. But with the allograft, which is someone else's tissue, that tissue, which doesn't have Downs, is now strong, and we put that inside her knee, and we were able to fix her problem.
I heard donated tissue, and I thought, oh, am I going to have to donate my tissue for her? Are we going to have 2 people recovering from surgery and not able to walk at the same time? He said we would get it from a tissue bank. Such a huge relief. And then I realized that this would be a generous gift, to think that someone would care enough about what happened to someone else that they would be willing to make that decision. And in Naomi's case, because it involves both her knees, it was going to be 2 people. And that just meant so much to me.
You don't think about that sort of thing until you're not able to use your legs, or someone in your home or close to you is not able.
As I looked into her future, she needed 2 good knees that she could use to run and jump and play and do the things that are so meaningful to her. If I had the donor family in front of me right now, well, I'm a Southerner, so the first thing I would do is I would give each of them a great big hug. And I would say,
Just like me.
yes, you would too. And I would say, thank you is not adequate. I don't have the words to describe what you have done for my daughter in being willing to give this generous gift. And I would just say, may God bless you in the way that you have blessed us and really given my daughter a new lease on life. Instead of sitting and watching other people do the things that she loves to do, she can do it herself.
It's just a real blessing. Very grateful.
You know, Kevin, that's just such a sweet story. And I think it does highlight so much about these grafts and with pediatric patients that, as well as adults, but certainly with children, that it allows them to kind of stay in the game, participate with their peers, play. And, you know, certainly for Downs kids, activity is just so critical. And so I love that story. I love, you know, how her family just knows that for her to have to sit on the sideline, you know, she may sit on the sideline a lot in life, and for her to just be able to keep playing the sport is just so incredible.
It's really a gift, and it's amazing to see how fast children recover too when receiving these types of grafts.
Yeah.
So it's a very cool story.
They're so resilient. So that's the end of our program. I'd like to bring all our speakers on for questions. We do have quite a few questions. So one of the questions we have is, do patients who've received allografts tend to have similar rejection issues as organ donor recipients have? Kevin, I'll let you go ahead and take that one.
Oh, sure. Yeah. So there's a few factors which help in this respect. In general, with most of the grafts we produce at MTF, allograft bone transplant involves bone that has no living cells, so that the risk of rejection is minimal, opposed to organ transplant where living cells are present and the need for immunosuppressant drugs would certainly be there. Since the transplanted bone that we normally use at MTF does not contain any living marrow, especially with large grafts, there's no need to match blood types between a donor and recipient, which further destroys the immunogenicity of the graft. Some of our processed tissue is decellularized, like are some of our skin products and dermal products, which also helps to lower the immunogenicity of the graft. And of course, freezing the allograft at cryo-like temperatures has also shown to mitigate the immune response. So all these together, help to mitigate any kind of immune response necessitating immunosuppressant drugs.
Great. Another question that came in, Lisa, I'll give this to you, is when the dermis is donated and used in a graft, such as Alyssa had, actually, this question is for Alyssa. I'm sorry, not Lisa, although it is for both of you. Does that skin become part of her own skin?
So just to clarify, is the question any application of a donated graft becomes the patient's skin?
Yes.
Okay. So yes. So for wound care, we do have acellular grafts that act as a scaffold. And so it really is to help that wound. Sometimes the wound may be very big. And if the patient is already ill or immunocompromised, may have diabetes, for example, they just can't get there and close that wound with their own capabilities. And so that graft does take probably a little over a week. And so then it does become the patient's own skin. And because of how we recover the tissue for application, there's no concern of any skin tone changes or anything like that. It will incorporate as expected.
That's great. So another question we had is, do we see donor families meet up with their recipients through our Linking Lives program? And it is rare, in part because tissue is distributed so broadly across the United States and the world. So often recipients are very far from each other, whereas with donor family programs or donor family recipients, the organs are often placed within a region that tends to be geographically somewhat closer. However, we did have a surgeon who received a large graft from a young man in Idaho, and he did meet his donor family last year at a meeting, and they communicate quite a lot, and it is just it was a really powerful thing to see, and their relationship is quite unique. So I'm sure that a lot of donor families would love to meet up with the recipients. But as I mentioned before, with our Linking Lives programs, it's still less than 1% of donor families will ever receive a thank you letter, and that's how we really do that. So I'm going to just do one more question, and then I think we have to wrap up due to time. So Lisa, I'll throw this one to you. How long can a tissue graft be preserved before it's transplanted?
So it really depends on that tissue type. So each of our different tissues are processed differently. They're stored differently in a way that's not going to affect the integrity of that graft. So it's going to be safe for implant, but it's also going to be efficient in clinically also. So it really does depend on the tissue type. So our dermal grafts are preserved for 3 to 5 years. Our costocartilage grafts are also 3 to 5 years, but it really does differ from tissue type from one to the next.
And even though they have that type of life to be able to be in a package before they're actually transplanted, it's very rare that we have them that long. They tend to be transplanted very shortly after their process due to demand. So, and someone else had asked if they could donate for research, and absolutely, research is a wonderful way to give the gift. We do a lot of research here at MTF, and it's just a wonderful way to really help maximize donation and come up with some of the newer grafts that we do have, such as the adipose grafts and the cartilage grafts that Lisa was talking about they're very new, and our fiber grafts, which are more in Kevin's department. So to learn more about tissue donation, you can visit us at mtfbiologics.org. And if you're interested in becoming in registering to become a donor, please, you can go to www.registerme.org, and that will take you straight to where you can register to be a donor in the future. So I think that's all we have time for. I really would like to thank our panel for joining us today, as well as our audience. Thank you for taking the time out of your day to join us. If this session has sparked your interest in learning more about organ donation, please go to those 2 sites that I mentioned below and just learn more. There's stories on our website. There's more stories than the few that you saw today, and we would just love to have you take advantage of that and learn more. So thank you so much, everyone. Thanks for sharing your day with us, and I hope to see you on a future FaceTime or Facebook event. Thank you so much, everyone. Bye-bye.
Thank you.